What is inflammation? Inflammation is a process by which your body's white blood cells and the things they make protect you from injury or infection from outside invaders, such as bacteria and viruses. How inflammation works. Chemicals from your body's white blood cells enter your blood or tissues. This raises the blood flow to the area of injury or infection. It can cause redness and warmth. Some of the chemicals cause fluid to leak into your tissues, resulting in swelling. This protective process may trigger nerves and cause pain. Higher numbers of white blood cells and the things they make inside your joints can cause irritation, swelling of the joint lining and loss of cartilage, which are the cushions at the end of bones over time. You might notice a swollen joint that may be warm to the touch, joint pain, joint stiffness, or a joint that doesn't work as well as it should. Often, you'll have only a few of these symptoms. Flu-like symptoms. You might have symptoms that leave you generally feeling unwell. They can include fever, chills, fatigue or loss of energy, headaches, loss of appetite, and muscle stiffness. Other symptoms: you also might have pain in your belly, rash on your skin, diarrhea, constipation or acid reflux, sores in your mouth, weight gain or loss, depression, anxiety or other mood disorders. How inflammation affects your internal organs. Other symptoms of chronic inflammation depend on which organs are affected. For example, inflammation of your heart, myocarditis, may cause shortness of breath or fluid buildup. Inflammation of the small tubes that take air to your lungs may cause shortness of breath. Inflammation of your kidneys, nephritis, may cause high blood pressure or kidney failure. You might not have pain with an inflammatory disease because some organs don't have many pain-sensing nerves. How is inflammation diagnosed? If you seem to have chronic inflammation, your doctor will ask about your medical history and do a physical exam, focusing on the pattern of painful joints and whether there are signs of inflammation, whether your joints are stiff in the morning, any other symptoms. They'll also look at the results of X-rays and blood tests for biomarkers such as C-reactive protein, CRP, erythrocyte sedimentation rate, ESR. Your doctor will look for ways to treat your inflammation symptoms and also any underlying causes. Inflammation treatment. Treatment for diseases that cause chronic inflammation may include medications, rest, exercise, and surgery to correct joint damage. Your treatment plan will depend on several things, including your type of disease, your age, the medications you're taking, your overall health, and how severe the symptoms are. The goals of treatment are to correct, control, or slow down the disease process, avoid or change activities that aggravate pain, ease pain through pain medications and anti-inflammatory drugs, keep joint movement and muscle strength through physical therapy, lower stress on joints by using braces, splints, or canes as needed. Medications for inflammation. Many drugs can ease pain and swelling. They also may prevent or slow inflammatory disease. Doctors often prescribe more than one. The medications include non-steroidal anti-inflammatory drugs, NSAIDs, such as aspirin, ibuprofen, or naproxen, corticosteroids such as prednisone, anti-malarial medications such as hydroxychloroquine, disease-modifying anti-rheumatic drugs, DMARDs, including azathioprine, cyclophosphamide, leflunomide, methotrexate, and sulfasalazine, biologic drugs such as abatacept, adalimumab, certolizumab, etanercept, infliximab, golimumab, rituximab, and tocilizumab. Some of these also are used to treat conditions such as cancer or inflammatory bowel disease, or to prevent organ rejection after a transplant. But when chemotherapy types of medications, such as methotrexate or cyclophosphamide, are used to treat inflammatory diseases, they tend to have lower doses and less risk of side effects than when they're prescribed for cancer treatment. If your doctor prescribes any medication, it's important that you meet with them regularly so they can watch for side effects.